This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended.
Hi, this is Dr. Deepak Megur, and here I am with yet another case. This is an elderly male patient with an hypermature cataract. The surgery is being done under topical anesthesia. The side ports are made. Trypan blue is introduced into the antechamber to stain the capsule under the air bubble. It is then irrigated out and the chamber is pressurized with dispersive OVD. So in this case, there will be two main challenges. One would be to get the rhexis right, and second would be to deal with the floating nucleus. I don't know the density of the nucleus as of yet. Let's see how things turn out. The rhexis is going to be challenging simply because there will be liquefied cortex which comes out, and also to deal with the nucleus, I need to have an appropriately large rhexis. At the slit lamp, there wasn't any evidence of phacodonosis. I'm hoping that the zonules are healthy. After creating the main incision, time to perform the rhexis. As soon as I perforate the capsule with the forceps, as expected, the liquid cortex escapes out and hampers the visualization. However, the visualization is not so bad, and I end up completing the rhexis, but the size of the rhexis is not ideal, looking at the size of the underlying nucleus. So I'm just trying to irrigate out all the loose lens matter which is there so that further visualization is not hampered. Looking at the bulk and the density of the nucleus, I thought I should enlarge the rhexis. The chamber is refilled with OVD, and using a micro scissors, a tangential cut is given at the rhexis margin, and then using the forceps, the rhexis is enlarged to the appropriate size. So we have an appropriately sized rhexis, and this should serve me well to manage this dense nucleus. Time to phaco. So these are the initial settings. I'm going to sculpt the nucleus, create a small central trench. The power is set at 90% and the flow rate is very low and vacuum is low. Since this nucleus is quite dense, I want to have a very firm grip before I attempt a chop. And that's the reason I'm going to create this small central trench, which is about 50%. And as I'm trenching, please note the nucleus is stabilized. I'm just using the torsional energy to create a small trench. And once I'm happy with the depth of the trench, here I want to perform a horizontal chopping technique. Hence, I'm going to change my chopper. And unfortunately, on that particular day, the horizontal chopper was not available, the Chang chopper which I typically use. But instead, now I'm using a long Sinskey hook. It's just a Sinskey hook which is just long. And let me demonstrate how to perform a horizontal chop using this long Sinskey hook. The settings are changed to the chop mode, where the phaco energy mode is changed to the longitudinal energy. I'm using a burst mode energy. The power is set to 30%. I'm going to give a couple of short bursts, and then the nucleus is pulled towards me and lifted up. The long Sinskey hook hooks the equator exactly opposite the position of the phaco tip, and then the scoring is done, bringing the Sinskey hook towards the phaco tip. And then we have a split of the nucleus, which is not through and through. It is, the split stops at the phaco tip itself. If I just replay and show you, there is a small amount of torque during the chopping maneuver. This happens when the hold of the nucleus is not perfect and we are using slightly more force to get through this dense nucleus. The tip re-engages the nucleus and the lateral separation maneuvers are repeated, so that we get a full thickness crack until the posterior plate. But mind you, this doesn't run along the entire span of the nucleus. It is just stopping at the distal half. The nucleus is gently rotated. The tip goes and engages the nucleus. The nucleus is lifted up. The horizontal chopper, which is a long Sinskey hook in this case, goes and hooks the equator, and then it is pulled towards the phaco tip, resulting in a crack. There would be some attachments at the apex in between these two fragments, so we need to have multiple attempts of lateral separation, although very gently, to ensure that the last leathery fibers of the posterior plate are separated. And this can be very safely achieved by placing the chopper, that is the long Sinskey hook, progressively at a deeper plane. The second heminucleus is then rotated and brought in line of action. The tip goes in and buries the nucleus. The chopper goes and hooks the equator of the nucleus and then moves towards the phaco tip and then the lateral separation maneuvers ensure that the posterior plate is separated. During lateral separation maneuvers, I want you to notice that the right hand, which is holding the nucleus, is actually pulling up the nucleus while the left hand is going down and laterally. So this maneuver ensures that we are not exerting any pressure on the posterior capsule and the zonules. Mind you, these cases don't have the support of the epinucleus, so we need to be as gentle as possible during the lateral separation maneuvers. The last bit of fibers, which is the bridge between these two fragments, is broken under direct visualization using the Sinskey hook. So time to emulsify these fragments. The first fragment is pulled out of the bag and then emulsified. Again, the settings are changed to the continuous torsional mode, which has better cutting ability so that it can consume the nucleus a bit faster. OVD is replenished into the eye and the second quadrant of the heminucleus is now being emulsified. Care is taken not to produce any turbulence in the anterior chamber. As we can see, by judicious use of Phaco energy, the nucleus is just dancing around the Phaco tip as the size of it progressively decreases and eventually disappears into the mouth of the Phaco tip. The key here to maintain a low turbulence is to use the energy judiciously. The only secret is we need to go a little bit slow and ensure that the fragment doesn't leave the tip at any stage. Time to replenish the OVD. The remaining two fragments are brought to the opposite quadrant so that I can access it easily. I changed my second instrument to a short Sinskey hook so that I don't inadvertently touch other structures with the longer instrument which I was using earlier. Again, as the quadrant is being consumed, please note that the movement of the quadrant, it is just flying around the tip. It is far away from the cornea, and this ensures that your endothelium doesn't take a hit. Again, the second instrument is also guiding the fragment as it is being emulsified. The key to a clear cornea in the first post-op day, number one is always the plane of emulsification. That's how far we are from the corneal endothelium. And number two is how can we minimize the mechanical trauma to the endothelium, which can happen because of high turbulence. High turbulence inside the chamber can push these dense fragments away from the Phaco tip and can hit the corneal endothelium. So that can be a real reason why we can have corneal edema in the first post-op day. There's hardly any cortex left. Very little cortex is there, which is then aspirated. A time to implant the lens. The bag is filled with OVD and the planned multi-piece IL is placed into the bag, and then OVD both in front and behind the lens is aspirated. Okay, just to summarize, for all these hypermature, free-floating Morgagnian cataracts, horizontal chopping technique is a better bet. And we can also use a long Sinskey hook like the one which I demonstrated here to do the nucleus division part. Key aspect here is to be very gentle with your lateral separation maneuvers, and presence of this longer Sinskey hook helps us to reach the posterior plate much more effortlessly and to achieve the crack in the posterior plate quite efficiently. So that was it. Thank you for watching and hope you found this helpful.